Initially was trained as a psychoanalyst, but over the years, as part of my own journey, I trained in 18 other types of therapy. About 15 or 16 years ago, when I was working with a group of trainees, most of which who had come from very difficult backgrounds in Central America, they had been in prison, they had been tortured, but now they were being trained as professionals. I began to realize that everything I knew in all the types of therapy that I practiced wasn't enough, because they had been traumatized and I didn't have the tools to understand what that meant, and none of the therapies were particularly effective. And we can see that whether it's analysis or Gestalt therapy, or many of you may run into this being NLP coaches, that you keep coming back to the material, they have to do it again and again. So I started a journey of many years finding out what really is psychological trauma. And in my training, you will experientially and intellectually really get a very good idea of what is psychological trauma, what is the neurological base, where is the trauma stored, what are the ways people try and cope with trauma. And one of the first things that happens we see when you're being traumatized. Now, I don't just mean trauma. Physical and sexual abuse is pretty obvious. But if you humiliate a child over and over again, if you have to at 6 or 7 become the parent and be responsible, you've been traumatized. Often borderline diagnosis, attention deficit disorder, bipolar disorder, even severe depression, doesn't seem to respond well to treatment or medication. That's almost always a sign that there's underlying trauma. If you go and heal the underlying trauma, then you find that that's an incorrect diagnosis, and the person really begins to get back a very high level of functioning in their life. But in this training, you all find out neurologically what's happening. You'll be able to understand how the person defends by producing disconnection or dissociation, that all trauma produces some attachment problems. People lose their ability or have a fractured ability to connect and be with people, that many of the symptoms that we misdiagnose really will give you a clue as when to look more seriously at the person in terms of, is this trauma-based or not? And then there's what I call neurological or biological, neurobiological trauma resolution. How to know if it's trauma, what level to work at, and exactly what you need to be doing at exactly what point in time. So one of the big problems is now, in the last 12, 15 years, we may have 5, 6, 7, 8 very effective ways of working, most of which I'll be talking about in the training. But when do you use which one? When do you use what you've been trained to use in helping to work with the trauma? And most importantly, how do you build new resources and help the client discover old resources? Because without stabilization and resources, anything you use to work with trauma will re-traumatize. So often you re-traumatize. The most important thing here is not to re-traumatize, to allow the patient to tell you what the real trauma is, not what you'd be traumatized by. And then we will be working as part of the course with how can the therapist avoid trauma. Because when you work with this, you can have secondary trauma. So how to protect yourself from secondary trauma. And last but not the least, when people have been seriously traumatized, you can deal with the physical trauma, you can deal with the psychological trauma, but there is also a spiritual wound. They begin to feel that the world is chaotic, they can't trust anything, there's nothing larger than themselves in the universe, and they're isolated and alone. So we'll be working with the spiritual wound as well. In closing, what I'd like to say is I began this journey because I knew a lot, but what I knew was not enough. And I've spent many, many years studying and talking and training with all the experts, combining all that information together so that you don't have to go on the same journey I went on, spending years tracking this down, and can begin to integrate it and use it in a positive way, no matter what kind of therapy or coaching, or if you're a school teacher, anybody who is going to be working with a traumatized population really can benefit from taking this training. And I look forward very much to the camp and to meeting you in many different ways.